Hi, it's Pinky here. I'm an internationally certified lactation consultant. I've got a little tip for you about feeding your baby. You know, sometimes mothers get upset because their baby grunts and squirms and seems frustrated as he feeds. Now, if this is a little baby, some bigger babies get impatient as they're waiting for the milk to start to flow. And if this is happening for you, try visualizing milk flowing over a waterfall, or try visualizing a really peaceful scene, and maybe that's a waterfall. Just do some of your deep, slow breathing to help you just relax and get those hormones going so that your milk flows. But sometimes with a little baby, they might be affected by a bit of tummy discomfort because as they start to suck, it might stimulate peristalsis. That's your stomach moving the food along, and might be moving a poo or some wind along, and your baby's having a little bit of difficulty coordinating sucking, swallowing, breathing, and farting. It's one thing too many for that little baby, and he's trying to work through it. So you can take him off and perhaps do some little tummy massage, or do some little leg bends and see if he can get his farts out, and then pop him back on the breast. If he's making a squeaky noise like that might mean he has a little bit of wind, and you might need to give him a little burp, sit him up and give him a little burp, and then pop him back on the breast. But the squirming is often something to do that's going on in the tummy. Now, tired babies or babies who've been crying, they can find it difficult to just organise their feeding behaviour. If your baby's been crying is a late hunger signal. So they can be quite uncoordinated when they start their feeding. So you'll need to settle your baby first if your baby's been crying before you then put them on the breast. And if they're getting tired, this can be, they just may not be able to organise their feeding behaviour. So the best way to help your baby feed well is to watch your baby, not the clock. Watch your baby's feeding cues. Is he putting his hand to it? If he's a newborn, putting his hand to his mouth, making these little noises, rooting towards your chest, or who is holding him. They're all very early signals that your baby would like to be fed now. And if you feed him when he has those early signals, he's going to organise his feeding behaviour better. He's going to suck in a better pattern, and you'll find feeds so much easier.